Okay, so the topic of my presentation is going to be exploring challenges and future roles of AI in surgical education. And I'm going to focus on the scoping review and the virtual panel that we have done. So the outline is going to be first, development of a general definition of AI in surgical education, which was a part of or a preliminary work for the scoping review. And I'm going to go through details of the methods and the results of it. And finally, I will talk about the AI virtual panel that we had in the summer of 2021, and then at the end with some conclusion remarks. So first, I will start by definition of AI in surgical education. And this is an editorial that was recently published in the Surgical Innovation Journal. And here we had a quite of a sort of interdisciplinary team. We had expertise in AI through Dr. Rahimi, expertise in medicine through Dr. Panero, and expertise in educational technology through Dr. Harley and Dr. Young, of course, along with myself and our PhD student who is now a plastics resident at McGill, Andrew. So when we were starting to prepare for our scoping review, something that we found is that when we're looking at the literature, it seems to be quite fragmented in terms of people's opinions of AI. Some people really love it, they see a lot of value, whereas other people found it very scary in some sense, and they didn't understand the value of it, they didn't believe in it necessarily. And when we were also looking at definitions of AI to help us build our search strategy for the scoping review, we also found that there's not much out there that we could really use for surgical education. They were all super general definitions that, in my opinion, weren't that useful within our surgical education context. And so when we found this sort of fragmentation and this lack of definition that we could use for surgical education to help us build our search strategy and as a reference for us to go back to when we're building it, we decided that we wanted to develop a brief and accessible definition of AI for surgical education. And so we actually conducted a literature review. Again, it's not a comprehensive review, but a literature review of computer science engineering, general kindergarten to 12 education, and healthcare contexts. And we try to understand the types of definitions that those fields have provided, so that ultimately we can combine some of those definitions and develop a general definition of AI for surgical education that we could use in surgical education, but only that way, when you have an interdisciplinary team of people, everyone understands what we mean by AI in surgical education and the definition that we want to use when we are developing and testing and implementing these educational tools. So ultimately, based on looking at the literature for the various fields, we developed this definition. And here, the definition is that AI in surgical education is an intelligent agent that acts to fulfill or support the fulfillment of educational tasks traditionally performed exclusively by surgical educators through making decisions in a manner similar to educators and providing customized adaptation, including performance assessment and feedback to surgical trainees. Again, this definition is also available in the editorial that was published. And we just felt like this is a much better definition that we could use when we are building our scoping review, and one where in the future, when we are actually conducting these studies related to AI in education, that we can use this as as a starting point, and where as a starting point not just for ourselves but for individuals from other backgrounds.
Just one thing for me related to the definition. I don't see the idea of tutoring.
Right.
I don't see the idea of coaching or anything like that. Was not that considered to be involved with these intelligent agents?
Well, I think when we meant by, so when we talk about, decisions that are made in a manner similar to educators, but also, I think that concept, we meant to incorporate some of those things that you mentioned, the idea being, you don't need the physical presence of someone, but some of these decisions, including ones that are made in those intelligent tutoring systems, etc., can be made in a similar way to educators. So that was the idea. So it was meant to include those different, I guess, techniques or technologies. So yeah, I hope that answers your question.
Okay, thank you.
Perfect. Okay, so now that we developed this definition, the next was actually to to start building our search strategy for the scoping review. So the scoping review was exploring artificial intelligence in surgical education. What has been published so far, reporting findings from a scoping review. And again, this was published in American Journal of Surgery, and that I know Rolando has provided the PDFs for. So here too, we had an interdisciplinary team of experts from AI, medicine, and education, in addition to a librarian, Andrea, who really supported us throughout the whole process, and who's the one that we worked very closely with to develop the search strategy. And then she's the one who conducted the search as well. So she was a very important part of the whole process. Again, I think we all know, and we all, since we are all here, we shared, the same idea that, there has been an increase in technology and teaching and learning, AI being one of those, and creating this adaptive, personalized, and automated educational platform for feedback and assessment. But even though AI in surgical education has started to grow, obviously, it is still at its somewhat infancy. And so that's why we wanted to really explore what has been done so far and the challenges and anticipated future roles of AI in surgical education. Sorry, it's going automatically. I'm not sure why, but basically, this is a very overarching objective. And as I go through our results, I will divide it into the 5 objectives that we have, so that the results will be a lot more clear for you. So in terms of the methods, we searched quite a bit of different databases, including engineering, computer science databases, and we included studies until January 2021. So I understand that now there would be more studies published in this domain. So this is just for you to acknowledge. In terms of pilot screening, so we wanted the process to be very rigorous. So we did pilot screenings for the abstract screening phase, the full text screening phase, and the data extraction phases. And ultimately, we included studies that were empirical and that reported data on AI in surgical education, focusing on medical students and/or surgical residents. At the end, we identified around 18,500 articles, and at the end, based on our inclusion criteria, included 93 to extract data from. So in terms of paper characteristics, most of them were published after 2015, which again, I think gets to that point that it is still at its infancy. It's growing, but it only started to take off, I think, starting to 2015. In terms of journal types, it was mostly, I would say, a somewhat balanced division between computer science engineering journals and medical surgical journals. And USA was the most, the country that mostly published related to AI in surgical education, followed by Australia, Canada, and France. Regarding the study design, most of them were cross-sectional in nature, just assessing the participants once and one in a single time point, and then testing out various AI techniques after. Also, again, most of them is where the data actually came from the study. It was collected as a part of the study, so it was a primary use of the data. And 86 of the 93, were single groups. So all participants completed the same tasks, the same skills, etc. And 76 of the 93 were assessment only. And what I mean by this is that it wasn't about simulation or training or operative training. It was just focused on assessment for many different purposes, but assessment only. So as I said, we have 5 objectives. I'm going to go through each of them and tell you the results that we find. So our first objective was about exploring the educational roles of AI in surgical education. We wanted to understand why someone developed or used that technology, and what are the types of AI techniques that they've used, what were the skill domains targeted, and what were the educational platforms targeted. In terms of setting, I think not that surprising. Most of the studies were done in the simulation setting. 5 were in the OR, 3 in both, and 1 in the classroom setting. In terms of types of simulations, most of them were benchtop simulators, followed by screen-based virtual reality, and the rest is sort of very minimally studied. In terms of type of skill, again, most of them were technical skills, and I will go deeper into what those technical skills were. And I think the most targeted were basic laparoscopic skill or robotics. And I put these 2 pictures because the top one is the fundamentals of laparoscopic surgery simulations, training program and assessment. And it was used a lot, especially this PEC transfer and laparoscopic suturing tests were used quite a bit. In addition to this robotics, virtual reality tests were used quite often as well. But I think that a lot of like 19 of the 93 studies actually tested their AI techniques on for more of the tasks, not just 1 or 2 tasks, but more. Regarding the population, and this is based on author classification, a lot of them were residents, and 23 were inexperienced or trainees, again, based on how authors classified them, and 12 were medical students. And I think this is an important point to say is that when we were doing the screening, we had a very hard time understanding what the population is because they were not clear. I think this was especially, I found this in the computer science engineering journals where they just mentioned novice, but they have not defined who that is, which I think is important for the readers. Regarding purpose of using AI, as I've mentioned before, a lot of them were about assessment, especially skill classification, where they use the data to compare, for instance, a senior versus a junior, or faculty versus a med student, faculty versus resident, etc. 9 did focus on feedback, and 19 again had multiple purposes, and it's not just assessment and feedback, but many other purposes. Regarding metrics, a lot of them used multiple techniques, and this included grading scales such as GEAR, which is for robotics. Also physiological measurements like heart rate, skin conductance measures, etc. Now 19 is automated computer measurements, and I differentiated this from motion metrics because the automated computer measurements are the ones that are collected automatically by the simulator and providing that individual and that cumulative score, whereas motion metrics I define it as ones where they use external hard drive to do it. So I think a lot of the time we can understand that the automated computer measurements were more, we define it as the ones that are used with VR, VS, or that virtual platforms. AI techniques. Now, this is actually, a lot of them used multiple techniques to try to determine, which technique works the best, which I think is a lot of the time what is done anyways. But 19 focused on different versions of neural networks. 8 focused on vector machines, etc. But I think that 36 using multiple AI techniques is an important point to make, I believe. Regarding objectives 2, 3, 4. Now, our second objective was, did the researchers use any educational theories or frameworks to guide their development and implementation of these AI technologies? And the answer is, based on the articles, we only saw one study that briefly mentioned deliberate practice, constructivist theory, without really diving deep into how those actually help them build, develop, and implement these technologies. In terms of our objective 3, which was determining students' expectations for AI, so its contribution to their success, their AI-directed emotions, perceived usefulness of the current or future AI-enhanced systems. We only found one study that assessed perceived quality of the AI-enhanced simulation training, and of course it was positive, but we just found one. And regarding objective 4, which was about how students and teachers are trained in order to use and learn with AI-enhanced educational materials, we actually haven't found any study that specifically said this is how we trained our residents or medical students to use these educational technologies during the study, for example. Objective 5. Now, this was about exploring the challenges and anticipated future roles of AI in surgical education. So for this, we actually did a qualitative analysis of the discussion sections of the articles to determine these challenges and future roles. So regarding current challenges, we identified 5 themes. It was study design, data, feedback, skills investigated, and simulator. Now, the study design was about number of institutions, participants, timing of the studies, and then data, which was the most mentioned one, especially regarding limitations as well, was about sample size, types of data, including the metrics, the ground truth measures, balanced data, capturing data regarding equipment. Is it feasible to have raters to assess the different, for instance, videos or performances, the number of raters, etc. An analysis of data was about the AI techniques, the equipment that's available, the transparency of the analysis, time efficiency, and using public data sets. And finally, the data theme also had a component of access to data. Now, third was feedback. And this is more about providing real-time feedback and the content of the feedback. Fourth was skills investigated. This is more about complexity of the skills and also number of skills and tasks that were used. Finally, representing this, the simulator was more about representing the clinical setting, as some authors mentioned that the skills that they targeted or the simulation, tasks that they targeted was not necessarily the most representative of the clinical setting. Regarding the future roles, we actually identified, I think, 12 themes, but the top 4 themes that were mentioned by authors quite often were study design, data, feedback, and skills to be targeted. Especially regarding data, a lot of the authors mentioned that they need a larger sample size and they need to test or use other metrics and AI techniques to try to determine the best way to sort of develop these AI-enhanced educational tools. Regarding study design, authors mentioned that especially they need diverse participants, because a lot of the time they were saying sometimes they had just homogeneous participants, but that provided some difficulties for them. So diverse participants and balanced number of participants for each of the skill level is important. And for feedback, it's about the content of the feedback, but also how to provide the feedback. Should it be done verbally, or it should be a verbal feedback? Should it be a visual feedback, maybe diagrams, etc.? And should it be haptic feedback, in what frequency, to what extent? So those are all very important sort of feedback future directions to consider. And skills to be targeted, it was more just about increasing the number of complexity of the skills, because as I said, even the current challenges that was mentioned, that's something that needs to be targeted. So just as a discussion points for the scoping review, we found that the most commonly used purpose for implementing AI was to differentiate skill levels. And also, a lot of the time, authors were poor at defining population, and that was very difficult for us throughout the screening process. And authors mentioned that some of the factors to consider when we're building these tools or these AI-enhanced educational platforms was, is it going to be done in a clinical versus simulation setting? For simpler versus more complex skills, is it more minimally invasive surgical skills or open skills? Will it be done for assessment or feedback? Well, if it's simulation, what are the types of simulation that are going to be used? Inanimate versus, again, virtual reality versus screen-based simulations. Well, what are the types of metrics? Again, I think this goes back to what is feasible to collect. And I think that ties with the different factors that I've mentioned. Also, resources to collect and label data. And that, I think, also goes back to, for instance, do we have raters to label data or to assess residents or medical students? And also considerations for benefits and limitations of AI techniques. And I think, the three things, objectives that we had that were not really targeted by any of the authors. How can theory guide the development and implementation of these AI-enhanced tools? How trainees perceive these tools, and also how can students be trained to effectively use these educational tools? Because in the literature, a lot of the time, the focus is more on AI being implemented in the clinical setting for clinical work, but training residents to use AI-enhanced educational tools is not something that's mentioned much. So in conclusion, for the scoping review, we saw that over the past 5 years, there has been an increase in the published literature, and the current challenges are more related to data, the type of data, the quality of the data, and also, of course, analysis of the data. And future direction is especially more about conducting further experimental studies where AI is used for feedback, and AI techniques being applied to more complex skills, and hopefully operating room as well. Now, our sort of third and final activity or study that we did was basically about bringing together experts in academia, societies, and industry to really understand their experiences with the development and implementation of AI-enhanced educational tools. So for this, we conducted a virtual panel, which again, as I mentioned at the beginning, was done in summer of 2021. And again, the idea is we want to explore the roles of AI in health science education, because these individuals weren't just from medicine; they were from different health sciences education backgrounds. So we had a very interdisciplinary team, but also individuals from across Canada too, including University of Alberta, University of Toronto, Queen's, McGill, CAE as our industry representative, Royal College with Dr. Richard Resnick, and MedTech, who helped with the moderation. And we divided the virtual panel into 3 themes. Was 1, what are the current advances? 2, what are the roles of educational organizations and industry? 3, what are the technical and ethical considerations to help advance and implement AI in health science education? So I will just go through key takeaway points that we have identified. First, and which is something that was also that I found in the scoping review as well, is there is a need, to build a collaborative culture, and not just within medicine alone, but across the different fields for both research development and implementation phases, and especially sort of interdisciplinary partnerships between industry, hospitals, societies, and academia, including law, ethics, education, computer science, health sciences, including students and residents. And this was something that was really mentioned frequently by the different panels. The second takeaway point was the development of these technologies has to be driven by educational theories, because ultimately the goal of these is to provide a better education for students and residents. And if we want to do that, we have to use educational theories to help us guide the development of these tools, but then development of curriculums around, with these tools, so that we can actually effectively teach students and so that they can learn to the best way that they can. Third point, it is important to gather multiple data using different data collection techniques, because ultimately we want to capture different aspects of performance, and that will help train a more accurate AI-enhanced educational models. So this multi-channel data collection it has been specified as something that's very important to consider, so that we're not just focusing on one sort of data type that might not capture the whole performance of a resident. Fourth, I think we just have to really understand limitations and understand uncertainties of AI models, but not just us understanding, but residents and educators who are going to use these tools have to understand these as well, so that when, for instance, educators are making decisions about a student's performance, they understand these limitations and uncertainties. So for, I think the fifth takeaway point was that, and that's something that was mentioned actually in the future roles or future sort of, pathway, is that we need to explore how AI can be used to provide real-time feedback. And I know sort of Rolando's team is working on that and starting a trial. But I think that's something that was mentioned quite often in the scoping review, but also amongst the panelists, is a lot of the time AI data is gathered with videos, and then later different AI techniques are applied to for instance, differentiate skill level. But how can we use AI to really provide real-time feedback, and what that would look like is an important point. The next takeaway was associations such as the Royal College have a role to really support this emerging need of students and health scientists regarding AI. So for example, Dr. Resnick was mentioning that they're going to add another CanMES role, the competency of digital literacy, to help with implementation of AI. Again, this is more about for the clinical setting, but I think a competence like this would help with AI for educational purposes as well. But also he was mentioning about creating another specialty, clinical informatics, and also helping faculty, so not just residents and medical students, but faculty as well, through continuing medical education to help them be able to use these technologies that are hopefully coming in the next 5-10 years, but they are coming. So how can we train faculty as well as residents and medical students for these new technologies that are coming their way? Also, some of the, I think whenever we're using these or developing these AI enhanced education technologies, we have to be very well informed of issues of privacy, confidentiality, discrimination, bias, fairness, accountability, transparency, and legal concerns. And one of the panels actually gave this example. It was a hypothetical example, but the issue that he was trying to address was a real concern. So for instance, if we're assessing a medical student on their suturing technique, And if the student has a flexible, the computer vision is actually going to assess that person a lower compared to lighter. And actually, as I was saying, this is a very big concern in computer vision. And so how can we really make sure that the educational tools that we are building are really fair and that we know who is accountable and there's transparency. So I think all of this is very important if we want to make sure that these AI enhanced technologies are creating the fair and the right educational system. So overall, based on everything that we have sort of done and seen, AI can certainly help optimize the education of surgical trainees. So ultimately, our goal is to develop a shared understanding of AI where multidisciplinary teams from computer science, and engineering, and education and health sciences can come together to develop and use these technologies within surgical education.